Hello, I'm David Wise,
And I'm Tim Sawyer.
and we are here to instruct you in the use of a device that will help you do trigger point release yourself on areas that need that kind of massage and trigger point release. And we want to introduce you to what we're calling the trigger point Genie. This is the trigger point Genie. And the trigger point Genie can allow you to do trigger point release over much of the body by allowing gravity to be the source of pressure on the trigger point, so you can relax, and particularly you can relax on a soft, comfortable surface, watching TV or not, and do trigger point release. The trigger point Genie consists of a circular plywood surface, and it has two what are called T-nuts in them, and the T-nuts accept a threaded rod. And this ball, which is a 2.5-inch lacrosse ball of hard rubber of a durometer of about 60, which is a measure of hardness, has a hole in it, and there's a threaded rod in it, and it screws in here. And once inserted, when you lie on it, like if I were to lie on it here, I don't have to be on the floor sitting on a ball. I can be on a soft surface, and the platform of the plywood allows the ball to push up into the trigger point as opposed to me pushing the ball down into the soft surface. The trigger point Genie has 6 different balls that are hard rubber, but there's a certain softness to them. It's not like hard plastic. These are a durometer, again, of 60, and you can press on them and they have a give to them. Again, all of these go on the threaded rod, and the threaded rod then goes, and it securely holds it, and we just screw it down until it stays, and then it remains rigid while we place a part of the body that is tender, that is sore, that needs some release with the trigger point, and Tim will talk about the trigger points in a moment. And gravity allows you to do this release without you having to exert hardly any effort at all. I'm going to take this out here. So the trigger point Genie comes with threaded rods of different lengths. Let's talk for a moment about trigger points. I learned about trigger points from Tim Sawyer. Tim Sawyer is probably, I always consider him the best trigger point therapist in the world. He trained with Janet Travell, who was John Kennedy's physician. John Kennedy had a lot of muscle-related pain, and he met Janet Travell, who helped him significantly, and he made her White House physician when he was the President of the United States, and then Lyndon Johnson made her the White House physician as well. And Tim had the privilege of meeting David Simon, who was Janet Travell's partner, and Janet Travell in the 80s, and trained and treated patients with them for many years. And we have the privilege of listening to Tim talk about trigger points, because he probably knows more about trigger points than anybody, as far as I'm concerned. So, Tim.
I was fortunate enough to meet Dr. Simons and his wife Lois, who was a physical therapist, and then I was able to teach with Janet Travell and Dr. Simons and Lois, and they essentially took this area and tried to present it to the world in these manuals, the trigger point manuals.
Why don't we begin by talking about using the Genie to do trigger point release on the glutes, which is one of the places that Tim and I work in the area of treating people who have pelvic floor dysfunction. And gluteal trigger point release is an important part of how we work with them.
If you're on the area of the couch, for instance, this larger ball can work some of the larger muscles of the hip, the glute medius and minimus. And these muscles typically are on the side of the hip here. And this muscle group can be pushed in this direction. Well, either you would have to get on the floor against a hard surface or against a wall. And this way, you could kind of just lie straight down on your side, find a pillow, and find the trigger point. A lot of times you could start sideways, find the hip area, and slowly roll into the trigger point. Right when you've located the trigger point, you want to find the most painful spot. We always want to start treating trigger points by greeting the pain. And as you greet the pain, then you could eventually take up more pressure. But you could hold these spots anywhere from 30 to 90 seconds. Once you get some reduction of pain, you could back off a little bit. You could put the Genie a little further back, and you can roll over a little further. And sometimes the areas can be very tender, so you want to take it really slow, and you could hold that spot. So on the sides of the hip, towards the front, here, you can get the TFL, which is the tensor fascia lata. Back up and go a little further, you can get the gluteus minimus. And if you go a little further, and without hardly any rotation at all, you can get the gluteus medius. If we want to then get to some of the bigger muscles in the glute maximus, we can go further back and just gently lie on it. If there's too much pressure, we can just gently raise up the pelvis, or we could gently lower down and to slowly find the tender areas. In the mid glute is the piriformis. And the piriformis, the critical area about the piriformis is that the sciatic nerve can run behind it or through it. So we have to be very careful in pushing this area. You never want to push an area that gives you a really sharp, intense nerve pain, and you want to gently take up the slack on that area. One other unique thing about the Genie is that there's these small insertional areas right around the greater trochanter. These little rotators can really work well if you just take this ball off.
Yeah, just pull it off.
And you could put a smaller ball onto the Genie. And same thing, you go into this position, find the bone, which is the greater trochanter, and just behind the greater trochanter are some tiny little tendon insertions. Let me move my hand out of the way. And right in these areas are the insertion, the ligaments and the tendons that insert from gluteus medius, minimus, obturator internus, and then some of these other rotators, the piriformis. And this is just a great area. Other balls are way too big to get to this area. And you could really get a lot of relief. So you can move that down all along that greater trochanter.
So here is the Genie, and again, I'm going to do what Tim said, which is that I'm going to roll over on the Genie, and when it hurts too much, I'm not going to roll over anymore, and I may want to roll back. But if I can tolerate it, and one of the criteria for tolerating it is that you have to be able to relax when you're doing it. If it's too painful to relax, it's too hard. And I'm just going to go over, and I can just go over like this, and I can feel the ball pressing right up into the muscle, and I can relax with it. And because I've done this quite a bit, I can rest right on top of it, and it feels good. It's like a good stretch, like a good yoga stretch is how it feels to me. And then when I'm done, I can go and I can move the ball and find another area, and I may find that after a while this whole area is actually pretty good. I can lie on it and there's no difficulty at all in it. And so these are the glutes that in my gluteal muscles, the way Tim is suggesting, I would be using the Genie for.
Usually patients that have glute trigger points also have the psoas trigger points and some trigger points in their abdominal muscles, and also some trigger points in their quadratus lumborum and trigger points in their lumbar paraspinals. And so the thing that has always been difficult is is to treat the quadratus lumborum. It's always been most difficult because most balls are really a little too big in order to treat that muscle. And so,
would you like to use it like this, Tim?
Yeah.
And so we're going to use, this is the 6-inch threaded rod.
And I'm going to use this tiny little ball. Most trigger point balls on the market, I think the smallest one is about this size, and the largest one, there's even larger ones in here, even still too big. Because the critical thing about the QL is it is in the side, underneath the 12th rib, and above the iliac crest. So this hip bone here and the iliac crest. So if I was to pull my shirt up, you would see the top of the hip bone and the bottom of the 12th rib. Right in that space, people want to try to get their QL. And if you use a big ball, it hits the rib and the bone. Even a smaller ball hits the rib and the bone. What we need to do is get a ball that's small enough to go into that space. And so there's a couple ways we could do that. One, if we comfortably lie down on our side, we could just lie our hand on the top, very relaxed, and that ball, just let it sink in. And sometimes it's slightly back or slightly forward, but if there's trigger points in the quadratus lumborum, sometimes referred to as the QL, you will find a very taut trigger point here. And in this position, very relaxed. Just on your side. And you could change the position of the platform depending on how much you need. But you're getting quite a good release of the QL in this position. So far to date, I haven't found anything that gets the QL quite this well. Then we want to look at the muscles in the abdominal cavity. So we could still use this longer rod, and we'll then use maybe a kind of a mid-sized ball, still in the small size. And this is an area where you could get comfortable and you could find any of the rectus abdominis muscles, which are the muscles that create the so-called six-pack of weightlifters. They go from the pubic symphysis all the way up to the xiphoid process here in the ribs. So you could start down low and you could just gently apply pressure. You could relax your arms there. And you could even change, if this position doesn't work for you, you could also change and put the knob in the middle. But I like it on the side because then I can start to go all the way up and actually get some torque and some different angles. So if I was on the right side, for instance, I could kind of angle in and gently press. The one main precaution when you're working on the abdominals, particularly on the left side or even down lower, is that this large vessel, the aorta, comes down to this area. So if you're pushing too deep on this left side, you might feel a heartbeat right down in here. And if you feel that heartbeat, you want to back off a little ways. If there's still tenderness in that area, you could do even some gentle strumming with this. Works really well. And you can work all the way up on both sides of the rectus abdominis. And this is all very shallow. And then you could even go into the oblique muscles, and you could find trigger points. And again, you don't need to push very hard to find these muscles. Find a tender spot. Hold it for anywhere from 30 to 60 seconds, always remembering that you're greeting the pain. Another area that is down on the inside is a muscle called the iliacus. So you find the bone of the hip and you go down and push out laterally. And you get a really great angle. Again, resting my hands right on the top of this, you get a good pressure release into that iliacus. And then the hardest one, I think, for everybody is to find the iliopsoas. You find the umbilicus or the belly button, and you go out about 4 to 6 inches, and you go press down about 10 to 15 seconds, add some pressure. And then the nice thing about this is that you could tilt this with your other hand and then just lie your hands right on there and really get a good pressure. And I'll do it on the other side. Now you just see the top of the board. So if I did it on the other side, you can see where this is going. Down and in. About 6 inches out from the belly button. Push down, gently breathing. Try to relax your abdominals. Once you get down about 10 to 15 seconds, you just tilt and just push inward. And this is hardly any effort at all. I'm just using the pressure, the weight of my hands and gravity. I'm really not using much pressure to push. And you breathe through it, 60 to 90 seconds, releasing that psoas. And then the last one in this abdominal area is the diaphragm, which lies right up under the rib cage, here and here. So if I find the rib cage, come down a little bit, and just push down and in, and you could just gently breathe through it. And again, because this platform is so big, it doesn't take much effort to push and use pressure on this. And I'll get my hands out of the way so you can see it a little better. Rib cage, down, and then pull up and out. This gives you a really good way to just find these areas. Nice and slow. Always gently breathing, never going into pain that is too significant. We always say between around a 3 to 5 on the pain scale of 10 is a good place to start. And again, if you're too close to the center and you feel that heartbeat, then you have to back off and not place any pressure over that aorta. David, you want to do a few of those just so you can, if he's been working on these, and his technique will be slightly different than what I just showed you, but you could see how from person to person this has a different, you just slowly modify it to kind of to work for you. So you want to do the rectus abdominis first, all along the center, and you're going to avoid the xiphoid process up in the top. And then you're going to just go straight down the sides and just check spots along the sides of them. And you don't need much pressure because it's a very superficial muscle, the rectus abdominis is. And if there's trigger points there, it won't take much pressure at all.
And I sort of hug the disc, and it's easy. It's not hard. And I just go down and relax. And here I'm just above the pubic bone now. And then I can go, as Tim showed me, to come up. I'm on the left side, so I want to be careful about if I'm feeling a pulse that I'm pressing on, I just move off of it.
And obviously he's going deep enough because he doesn't have many trigger points. If there was a person with lots of soreness in these muscles, you would hardly be able to tolerate any pressure at all.
So that's the rectus abdominis.
The obliques are just this kind of quadrant down in the lower, like as if you were putting your hands in your pocket, but higher. And so there's just an area of 3 or 4 spots, nice and slow. And
so
you can
here I'm doing this here like this, and then.
And the key thing is, the advantage is that you could find a position that works best for you.
And then when I find it, it feels really good to. It's a little tender, and I hold it, and it feels good. It feels like it's being stretched.
The adductor, there's essentially, they go from all the way up high in the inner leg all the way down to the inner side of the knee. And there's an adductor longus and an adductor magnus and adductor brevis. And the key thing is that you find the locations that are tender and treat them. And it's really easy to use this with a higher, about almost a 4-inch
Threaded
rod, and then this medium ball. You could also go down in the ball. You could also try a bigger ball, depending on the size of your leg. So that's the other cool thing, is that if we have someone that's 6'5" and 290 pounds, they may be using bigger balls. And then sometimes trigger points can be the size of a pinhead, or they could be the size of a grape, or the size of even sometimes the size of a golf ball. So sometimes you just need to be more precise. But in the adductor, you could lie sideways, and the adductors are right in here. You could just find the sore area, and then just gently lower your leg onto the area, and use this. And now there's no effort whatsoever. It's gravity. If it's too much pain still, you could put a pillow between your legs to ease the pressure. But again, the key thing here is that there's really no effort being involved. It's just you're allowing gravity to release this trigger point. When that one releases a bit, you could back up. You can go a little higher, just work your way down that adductor. Some of these can be very tender. You may not find one there, so you'll back off and move it a little bit. And there may not be one there, and you move it a little bit, and you'll find one there. Trigger points could be all the way down the line, or they could be just a few spots. Hold that one for anywhere from 30 to 90 seconds. Again, always greeting the pain. As you've done this a while, then you feel more comfortable going up in the pain level, but still we want you to gently begin this. If you bruise yourself, you're going way too hard. That is one really critical thing. And then you can work your way all the way down the knee. This is a very tender spot for soccer players and runners. And it's an area that once it releases, it can really ease up. These upper trigger points can really send a lot of pressure and pain into the pelvic floor. If you then change balls and back to the larger ball in the middle, you could do the outside of the quad, the outside of the leg. And again, you could start on your side. We found the TFL earlier, so now we just want to work our way down the leg and just really get that IT band. IT band and the lateral quad. Again, this is gravity. If you feel like there's too much, you can just back off a little bit. Very tender areas all along here. If you find an area that's really tender, you can go slightly down below it. Back off, you can go slightly above it. And then you work your way all the way down the side. And it's just simply moving. And again, the critical thing is that there's just very little effort. Gravity is the therapy tool here. And we've just created a platform for gravity to do the work. And we work all the way down towards the knee. And keep going all the way down. You do that on both sides. If this ball seems too big, then of course you could always experiment with smaller balls, but this big ball seems to be fine on these lateral areas. Once, if there's an area that's really tender, you could also use the big ball on the adductors too. But I think the longer rod helps to penetrate deeper into those softer muscles. As we work down the leg, another area that people have a lot of problem with, runners and hikers are particularly, and skaters, are areas of the calf pain and in the back. And sometimes this ball, the small ball, is just enough, or this larger ball can really do the trick, and you just roll back and forth and you can move yourself. And again, the key thing is find a position of comfort. You can lay back and relax on that area. Roll around and do a little trigger point release that way, or just hold and do static pressure. You can pick it up and move it again. And again, really, if you want to keep working your way up that calf, the calf muscles in here can become really tender and sore, and you could do the inner and middle. And even on these outside perineal muscles, you could just gently roll over on the sides. And these can be a source of really intense pain if you've done some long runs or hikes. Always be aware that you're looking for muscle tenderness. There are some nerves that come up higher here, so if you're up really high, it's very possible that you could push on a nerve. So just be very careful, looking for trigger points all the way down into the side. Holding that pressure anywhere from 30 to 90 seconds. If you want to work all the way down the foot, when you get into the forearms, you can again work your way down into the flexors of the forearm or the extensors of the forearm. And I think the longer one works well for this because you have a better lever. And you could just work your way all the way from the elbow down to the wrist on the inner side. Finding a spot and just use your hand to manipulate the area or move it towards the middle. Back and forth until you find an area. Roll the arm over. Just let gravity do the trick. If you need a little more pressure, apply some pressure on the top. Come down. Hold each spot for 30 to 90 seconds. These areas in the thumb, this is the thenar eminence, and then down and through here are these adductor muscles, and you can really push in to some of these muscles here with that. And I'll show you, even with a smaller ball, you could really get into some of these tiny little muscles of the thumb and just add some pressure there. And that's a real good release. Right into the thumb. And again, the advantage of having a smaller ball, you could really work your way around the hand. And then these forearm muscles, you could also, I think in the forearm, you could also just put it in this position and apply pressure. Or as David did, kind of reach out on your side and with a shorter one. Just leaning the arm right into that. It doesn't take much effort. Use your hand to guide it across. You're really finding some top bands there. Some tender areas that either refer up to the elbow or down to the wrist. You work your way around. A lot of folks with tennis elbow will have these trigger points. Coming back this way. All the way around. So the key thing is just to find a real comfortable position to do this. And if you have a good movie on, you could do an hour and a half of trigger point work and not miss any movie. I mean, this is one of the things. I think the compliance by which someone does their own trigger point work is huge, and people say they don't have enough time to do it, or it's hard to get it on and off the floor, or when I'm using the ball against the wall, it flips out. Generally, when I'm teaching how to do trigger point release of the upper extremities, I generally start with the chest and the shoulder girdle, and then work down into the forearm. And because there are a lot of areas in the chest and the neck that refer all the way down to the forearm, and if we could release those first, then we get down to the forearm. A lot of folks have just forearm pain that cause hand pain, and so they could eventually work just in those areas. So we'll kind of start in this little area of doing the pecs and the chest first, and then the back of the shoulders, and work our way down the forearm, and then at the end we'll do the neck. I'll turn sideways so you can just see this. You can put the ball in here. I'll show you how to do it sitting, just in this position, just to find the area. But again, if you're relaxed in a position on the couch, you could just bring your arms up and just really, with hardly any effort at all, find that trigger point. You could use both hands to do it. If you want to get even more pressure, you could just put it straight in front and put pressure this way. And you can move around that pec. Several areas can be in this muscle. And these areas often get tight sitting and reading and working on a computer. And if these muscles get tight, then they can create a lot of tension up into the neck and even down into the forearms and shoulder girdles. So the pecs, really good to get. Sometimes you could try using a smaller ball. I mean, a larger ball and a shorter rod. A shorter rod as well. And that's the thing about it, is just to try to get really unique. This is a perfect one. You can use it in the middle. And this gives you a little more surface area. And you can just put pressure right there. And then the exact opposite of this would be back in the shoulder girdle, the infraspinatus and teres minor and the rhomboids, these areas back in here. And I like to use a smaller rod on that one. Take this one off. Because you could just lean right up against it. Again, laying down on the bed or up in the couch. These are areas back in here. And so you could either just put it back this way and lean straight against it, or if you want to get in a lying down position, just like we did with the hips, you want to lie right in this area. You can roll right onto it with a large ball. If the large ball is too much, you can get a smaller ball. You can work into the deltoid. And if you roll over further, you can push it back even further and get into the rhomboids and the middle trapezius. You can put it down lower and get down into some of those mid-back paraspinals and the lower trapezius. You just find the spot, and again, let gravity do the work. All you have to do is find the sore area. And then you could sit up, push it back a little further, and go up further on that shoulder blade. One of the critical areas is this area right at the apex here. It's called the serratus anterior. And sometimes this ball, the bigger ball, would probably be just a little too much, so we want a smaller ball. And again, the key thing is finding the area up by the neck, right there at the edge of that upper trapezius. You can really find a sore area. This muscle can refer down to the shoulder or right up the neck and right down the back of the shoulder blade. Find the spot, hold it for 30 to 60 seconds. And depending on the size of the person, that's what's beautiful about the balls, is that these trigger points, this is perfect for me at the moment. This ball size gets right into the most painful spot. And then you could work this right up the neck as well. And if you want, you could put a pillow just on top of the ball and find a spot, and then, as David did, just get a longer rod and a smaller ball, and you can get all of these neck muscles. This one may even be too big, but let's just try it. So it's good to have some pillows around as you're getting down here on the side of the neck. Really slow, find a pillow. These muscles of the lateral neck are really tight, can be very tight and tender. Whenever you're working on neck muscles, you just have to be very careful that you're not irritating any nerves or blood vessels.
We hope that this time we've spent together with you showing how to use the trigger point Genie will get you well on your way to using it comfortably, safely. You may want to use a kitchen timer to time no more than 90 seconds, which is probably the limit of what we would suggest to do trigger point release in. There are idiosyncratic kind of ways in which people become comfortable using the Genie that work for them, and you'll just have to kind of find out how to do that. Use a comfortable couch or bed. Don't fall asleep on the Genie. That's one warning we want to extend. Don't fall asleep on the Genie, and that's where a bell or a timer will help. Be comfortable. The beauty of the Genie is that you can do this comfortably. You can do this watching movies and just relaxing, listening to music. We're excited about the possibilities of the Genie. We hope it helps you to loosen your body and be more comfortable in it.